Hey, what's up, guys? Welcome today to the Dennis Insider. And it's exciting news. We have a new integrated national board. Um, Exciting for some, not so exciting for others. So let's jump into it. We're going to talk about the new integrated national board. What is it? We're going to compare it with the existing INBDE Part 1 and Part 2, and then talk about the exam domains that are covered in the new integrated board, and then some information for the international students applying to US schools. So let's jump into it. What is INBDE? It's the Integrated National Board Dental Exam. So it's a new exam to replace both Part 1 and Part 2 by August 2020. It's a new curriculum standards to integrate the basic sciences that are in Part 1, behavioral sciences, and clinical sciences we find in Part 2, as it stimulates decision making for a safe dental practice. So they want to make sure step up the standards of how we are accrediting our dentists in the U.S. and just have an even playing field. So the international dentists and the U.S. Trained dentists are basically at the same level. So the last day for the existing NBDE Part 1 is August 2020. Sorry, August 1st, 2020. And then for international student, it has to be the July 1st, 2020 for international students to take the new integrated, to take the existing national board. Part 2 will be 2 years later, so the last day to take is August 1st, 2022 for Part 2 NBDE. After that, it will all be integrated national board. So let's compare INBDE to the existing NBDE Part 1 and Part 2. So first, I'm going to talk about the existing exam. First part has about 400 questions. The second part has about 500 questions. And usually part 1 you take either your freshman year or sophomore year, and part 2 you take in your junior year, senior year. So right now the cost for each exam is 425 plus 210 if you're an international student. You have to wait 90 days policy to retake the test. And the retest number will renew itself if you fail, let's say, 5 of the existing NBDE, and then you decide to take the INBDE, so you'll start again at 0. Now, talking about the integrated national board, the exciting part. So the good news is that it's only one exam, 1.5 day. You only take it one time out of the 4 years. It's 500 questions, so basically same amount as you would take a part 2 exam right now. So 500 questions, it's a pass-fail, no number scoring. You still have the 5 attempt policy and 90 days to repeat the test. There's no fee schedule right now. It will be open in February or March, but has to be super cheap than the existing, adding up both of the national board, part 1 and part 2. So going further, the national board, the existing national board, like I said, is 3-day exam. So you take part 1 on one day in your, let's say, freshman year, and then part 2 is 2 days, so that is 3-day exam. Whereas the integrated board, you only take it once, it's 1.5 days. So the existing national board part 1 is about 400 questions, your basic sciences. So this is your basics. So your anatomy, biochem, microbiology, dental anatomy, the picket fence, all that good stuff. You basically memorize these old books, old exams, and you are basically picking the best answer. Then you have the part 2, which is 2 days. So you have the first day, which is more discipline-based item. So you have your specialties like endo, orthopedo, diagnostics, patient management. And then day 2 was case testlets. So they gave you one case, came up with 10 or 12 questions, and it gave you the patient health history, chief complaint, dental charting, panos, um, medications, allergies, all that information, and you had to basically answer the question. Now, if we go to the integrated, the new national board, like I said, one exam, 1.5 day, 500 questions. It is ideal for international dentists or international students in the regard that you don't have to relearn the basics. So sometimes a lot of international dentists are working for a few years in their country, and then they want to come to the United States to study. So they have to relearn basic sciences for to take part 1, and then they basically know the clinical to take part 2. Now it is all integrated with the clinical and the sciences, so it has the diagnostics, the medical logic skills, unlike the old memorization testlets. The new topics that are covered in the integrated national board are, in addition to the existing topics in both part 1 and part 2, the new ones are craniofacial biology, genetics, biophysics, sociology, psychology, public health, evidence-based dentistry. And once again, just to put it all in perspective, they have integrated the basic sciences that we had in the anatomy, the dental anatomy content. They have integrated with some, every question will have the case item. So we'll have this chief complaint. They have to have some patient information in there. Um, Link it with the discipline that it falls under. Maybe it is a ortho, endo, operative, um, just diagnostic, any kind of patient management. And so part one and part two are both integrated together, and that gives us the new national board. Now let's talk about the foundational areas that they are covering in the new national board. So this is the framework on which the test is created. So they cannot ask you anything outside of this. So this is where I would start studying, is knowing the foundations and putting questions with the foundations. So that will keep you in check. So first one is your basic sciences, your biochemical, cellular system, development, structure, function. So basic biology, high school, undergrad biology integrated with some patient information. Then we have some physics and chemistry to explain the biology and pathobiology. Physics, chemistry to explain the use of technology and material. So this could have some dental materials in here. This can have any kind of chemistry, biochemistry involved on some cycles, periodontitis, anything like that. Then we have some genetic component, genetic developmental diseases, so pathophysiology. We have some cellular, molecular biology of immune, non-immune host defense, so immunology-based questions. We have general and disease-specific pathology to assess the patient risk, the biology of microorganisms in pathology, pharmacology, and we have some things that were in part two in BDE, such as behavioral sciences, ethics, and basically analysis, statistics, information tools. So all those things that were in NBDE part one, NBDE part two are all in this foundation um, knowledge area. So the three domains that the foundation areas that we just did, so we did foundation areas 1 through 10, they go from basic sciences and 1 to some more advanced sciences, immunology and pathology here, and then finally um, some extra stuff, if you want to call it ethics and all the other stuff in the 9 and 10. So the three domains they're testing you is, are you good at diagnosis and treatment planning? So that is 36% of the exam, and that includes, as you can see, most of the basic sciences. Then you have oral health management, which is a chunk of the exam, 42%, and that includes basically all the basic sciences, treatment planning, everything. Then we have some practice and profession. So those are the latter parts, the 6 through 10, and that's about 21%. So that's more about the National Board Part 2, and this is more Part 1 and Part 1, maybe Part 1 and 2, like that. Sample questions, real quick. So this is what, I have two examples right here. This might be medium type question. So here, just basic information that they focus on to the people that write the exam question. So that this is what they're telling them, is that the question has to have the patient box, which you're seeing on the left side over here. So this is my patient box. Every question has to have that. And then required thing they're asking their test makers is you have to have some patient information, you have to have the chief complaint, and then some optional that some questions might have is background information, patient history, like their medications, allergies, so on and so forth, current findings, radiographs, vitals, anything, charts to help the question. But the first two are always in every question. And now you basically will have 1 minute to read the information. So, oh, that's horrible. So you have 1 minute to read the information in the test site. It will cover 3 to 6 questions. Unlike before the testlets in part two, it was one big testlet with 10 to 12 questions. Now maybe they give you one patient box for one question, and the next question might have another patient box for 3 questions, and then something like that. So it's very random. So here you can see both of these questions have their test information. This one didn't have any current findings. So the first question on the left is, what is the best treatment for this lesion? And we have some patient information that's related with the age. He gave his chief complaint that they hurt. We have some recurrent gingival lesion that outbreaks for 10 days, and then vesicular lesion is what we find. So once again, all of this information, the picture has to help you with the answer. On the right, same thing, some patient information, his chief complaint, and then he had some background information, the left eye nerve block during the dental treatment. So now we have to figure out where do you expect loss of taste. So this has basically incorporated some gross anatomy, some of the basically nerve block, some pathology in there. A lot of different sciences have gone together with the patient information. All of this is integrated into the new national board. So lastly, I just wanted to talk about what things you should focus on when studying for. So they're looking for if you have the understanding or the recall of basic sciences. So things like, these are the question identifiers you'll find. Recognize this protein, define this term, identify what caused this. Then we have the application in level two. This is apply the treatment, develop the diagnosis, things like that, differentiate one disease from the another. And then lastly, we have some reasoning analysis. So as you can see, this exam has gotten a little harder than definitely than the part one national board. But putting both national board one and two together, where you just have to study one time, I think it's really beneficial. And I know we can do it. There will be a lot more information regarding that integrated national board, and I'll keep updating them on my channel. Plus, you can check out my other videos that are related to the new integrated boards